Hi, all. Thank you so much for joining me. I'm excited to be talking to you about understanding menopause hormone therapy. I am Dr. Stephanie Fairborn. I'm a naturopathic doctor at the Root Natural Health Clinic with a special interest in perimenopause and menopause. And today is the intention is to bring to you a conversation around whether menopause hormone therapy could be utilized for your care and what that could look like. So, hopefully, we are able to learn a few things today, breaking down and understanding perimenopause and menopause, the history of menopause hormone therapy, what that has looked like over the decades, benefits and risks of menopause hormone therapy, the window of opportunity. And what I mean by that is, what does that ideal timing look like with regards to when we should start potentially thinking about utilizing MHT as an option? And screening what that could look like and should look like as we age, and potentially when we are using MHT. And then what a menopause hormone therapy prescription could look like. We will be thinking a little bit more about that. For perimenopause, this is the span of time leading up to that final menstrual bleed, and it continues till 1 year after you have your final menstrual period. So women typically notice a lot of different changes with their menstrual cycle. So potentially, if you historically have had regular 28-day cycles, you may notice those lengthen. So maybe you skip a cycle a few months, maybe they just, kind of become a little bit longer. For some women, we see that shortening. So maybe every couple of weeks they will have a bleed, potentially changes to your overall bleed as well with regards to heaviness, maybe more spotting, potentially shortening or lengthening of that bleed. And we see at this time the frequency of ovulation definitely does decline as well. With perimenopause, we do see a lot of changes in symptoms potentially for women too that can really, really impact the overall quality of life. So we will see things like vasomotor symptoms, so things like hot flashes, night sweats. We will see things like insomnia, so changes to overall sleep patterns, potentially not being able to sleep very well throughout the evening. We will then also see genitourinary syndrome at menopause. So this is a big term, but basically refers to the changes in the tissue in the vaginal area and the urethral bladder as well. So a lot of symptoms that show up could be recurrent UTIs, vaginal dryness, irritability, overall things like sexual dysfunction, pain with intercourse. We also see fatigue, so overall women feeling very tired or not able to take on that capacity that they once felt they could. We also see worsening of mental health. So we see perimenopause as a window of vulnerability. So women are 3 times more likely to have a depressive episode, regardless of mental health history. So experiencing their risk for lower mood, lower anxiety, or higher anxiety, I should say. We also see body composition changes, so increase in fat mass, but also potentially the inability to maintain muscle mass, and many, many more symptoms. So estrogen receptors are all over the body. So with a decline in estrogen, we can see a lot of different symptoms arise. So things like joint pain, headaches, dry eyes, heart palpitations, etc. And we can see that symptoms can last up to more than 10 years for some women. So it is quite a long period with regards to if you are experiencing symptoms, it can really, really impact quality of life. And that is where potentially menopause hormone therapy can come into play as a treatment option. Testing for perimenopause. So a lot of women asked, do we potentially test hormones? And this is not something clinically that is always really recommended. Perimenopause is a clinical diagnosis. So we would go off of change of menstrual cycles, symptom picture, etc. There are some circumstances we do test hormones, but typically we do not. So menopause overall is defined as 12 consecutive months, so a full year of no menstrual bleed. On average for women, that occurs around 51 to 52 years, and 90% of women will have reached menopause by age 55. We do see at this point a loss of ovarian function and a decline in estrogen and progesterone, and increase in FSH. Again, testing hormones, though, is not overly indicative of menopause. It is that clinical place where we see that no period has happened for a full year. So, utilizing menopause hormone therapy as a treatment option is something that has a big history behind it. We know decades and decades ago it was utilized quite frequently for the management of menopause symptoms and osteoporosis prevention. In the early 2000s, a lot of results, or they stopped actually studies, the Women's Health Initiative, because they were seeing links to menopause hormone therapy increasing the risk for breast cancer, heart disease, etc. And so we saw that a lot of women's prescriptions were discontinued, and it wasn't overly recommended as much at that point. But we do see and have since then understood that that study actually included a lot of women that maybe weren't and definitely are not in that window of opportunity that we would clinically prescribe to today. So, women that were above 60 that already had increased risk for cardiovascular disease, they were using different forms of progesterone and potentially other hormones or other forms of estrogen. And typically, those risk factors were not screened as they are today. So, we know that the risks depend really heavily on your age, your personal health history, the type of hormone therapy you're using, and that timing. And so, hormone therapy is considered today a really helpful and safe tool if we're doing the screening appropriately, if we feel like your healthcare practitioners feel like you're a good candidate to manage some of the symptoms that come with perimenopause and menopause. So, why would we utilize menopause hormone therapy? What are the benefits? We do see those look like vasomotor symptoms, so utilizing it to manage hot flashes, night sweats. So, those can really impact quality of life if you're not sleeping very well and you're up all night, you're sweaty, you're hot. During the day, you're experiencing those overwhelming hot flashes. We also see sleep as an independent symptom. So, outside of night sweats, you might notice you're waking in the night. Hormone therapy can be quite helpful for that. Mood as well. So, if we're noticing changes with mood, we might utilize menopause hormone therapy as something to consider, and vaginal health. So, typically, if that was its only symptom, we might just utilize topical vaginal estrogen, which we'll talk about shortly. But vaginal health changes and menopause hormone therapy it is a great tool for that symptom. We also see another benefit as reducing the risk for osteoporosis. So, menopause hormone therapy has been shown to significantly reduce the risk of multiple types of fractures. So, that is an additional great benefit. We also see cardiovascular disease. So, menopause hormone therapy may reduce the risk of overall cardiovascular disease and all cause mortality. It slows the risk of atherosclerosis and managing a little bit, we think of cholesterol and blood sugar with delayed type 2 diabetes risk. So there is that cardiovascular disease benefit. Again, we would be already screening for unmanaged hypertension, cholesterol, things like that to make sure you would be a good candidate for menopause hormone therapy. Another additional benefit is the reduced risk of colon cancer. So, understanding if you are a good candidate, we want to be thinking about the window of opportunity. And what I mean by this is that ideal period of time where risk is low, and we are making sure you fall into that opportunity of time where utilizing menopause hormone therapy could be quite beneficial. And we do see that's within the first 10 years after menopause. So, if you go through menopause at 48, let's say, that would be up until around 58 or on average before the age of 60. So those are typically those timing windows of when we would at least want to start MHT around or before. So who would be a good candidate? So first, we want to make sure we fall in that window of opportunity. So starting before 60, before 10 years post-menopause. But we also need to be having symptoms of perimenopause and menopause. We also need to potentially have hot flashes, night sweats. Maybe we're having issues with sleep or mood, vaginal changes. We would not just prescribe because of the benefits to osteoporosis or cardiovascular disease risk. We want to make sure you are having symptoms that need management through menopause hormone therapy. We also would be screening to make sure you're a low risk individual. So, what I mean by that is you have no pre existing health concerns that are contraindicated with MHT. So, things like a history of breast cancer, stroke, heart attacks, blood clots, endometrial cancer, active liver disease, any sort of unknown clotting disorders, again, unmanaged hypertension or high blood pressure, unmanaged cholesterol, and more. So we would be doing full screenings with you would be doing full screenings with your healthcare practitioner to make sure you would be a good fit for MHT. So again, you need to follow in that window of opportunity. You also need to be having symptoms and you need to be a low risk individual. If you are looking to do a prescription for menopause hormone therapy, there are a lot of different types, doses, or regimes that can suit all different types of health concerns with regards to what that could look like. So we see estrogen could come in tablet, gel, patch, or cream form. Again, you would be discussing with your healthcare practitioner about what would be the right form and dosing for you. Progesterone would look like oral micronized progesterone, or if you have an IUD, you would not need to necessarily do the oral progesterone. The IUD provides that endometrial protection that we need. Again, if you have a uterus, you would definitely not be doing estrogen on its own. You would also be needing to take a progesterone, either through the oral form or an IUD. So if you're on and you have been prescribed menopause hormone therapy, there are some side effects that we could experience. So things like unscheduled bleeding, spotting. If that's the case, we would have follow-up care. We would potentially do some investigations to understanding why we're spotting, why we're bleeding, but it's the most common symptom we do see with menopause hormone therapy. We could potentially see some breast tenderness, some bloating or digestive upset, changes in mood, fluid retentions, potentially headaches and migraine changes as well. These are things you would track. You would definitely discuss with your healthcare practitioner and follow up to review this would definitely also be encouraged. So, with the prescriptions that we just discussed from estrogen and progesterone, those are more systemic menopause hormone therapy options to manage hot flashes, night sweats, sleep, mood, things like that. But we also have the option of a vaginal estrogen therapy. So, this is used for the treatment of the genitourinary syndrome of menopause and vulvovaginal atrophy. So, we do see that being useful for genital, urinary, and sexual symptoms. The root cause of this is really that lower estrogen, which is impacting the tissues of the vagina, the labia, the urethra, the bladder. And so we would be utilizing a vaginal estrogen option, and it comes in a cream, potentially a tablet, a ring. But it has a much more minimal systemic, I should say, absorption while still being really effective. So it can improve, we see vaginal lubrication, blood flow, and tissue sensation. And again, can really help prevent recurrent UTIs, which can happen in perimenopause and menopause. The relief also for overactive bladder symptoms and may also help with urge incontinence. So this is a great option if we feel like vaginal changes is really one of the main or only symptoms you may be experiencing in perimenopause and menopause. Screening for menopause hormone therapy is extremely important, and typically prescriptions are not provided unless we're doing the appropriate screening. So doing mammograms, that breast cancer screening, you can book your mammogram online. You don't necessarily have to have a doctor referral. You could book yours in Ontario online. Cervical screening, which now looks like HPV testing, you would potentially be doing your fecal immunological test or a colonoscopy around 45 years of age as the updated guideline recommendations. You would start with the FIT testing. As we age, we would also potentially be getting done bone density testing. That's something we would be potentially looking to assess as well. And then definitely blood work. So outside of the routine blood work that you would be having done with your healthcare practitioners, we would also, for menopause hormone therapy, be doing specific blood work to be assessed. So your cholesterol panel, blood sugar, so HbA1c, A1C, fasting glucose, fasting insulin. You would have your liver function tests, so AST, ALT, kidney function tests like creatinine and EGFR, and vitamin D. We would, upon a prescription, be then also doing follow-ups at a 3, 6, and 12-month intervals. So after your first prescription, you would follow up after 3 months, check in, how are you doing, adjusting dose, potentially discussing any side effects, but then also reviewing updated blood work and making sure we're feeling good. At that point, a renewal would potentially be provided, and then you would be spaced out until 6 months later. Again, you would then have that follow-up rescreening, check-in, and then potentially a renewal for a full year. Again, in this time, checking in with healthcare providers about all of the other benefits around perimenopause and menopause care. So there's so much research around lifestyle and other interventions outside of menopause hormone therapy that can be very, very monumental for your well-being and preventative healthcare overall. So, as a summary, my hope is that you understand and we're able to take away some great information to maybe make an informed choice for what feels right for you, and to also advocate and have that conversation with your healthcare provider. So, perimenopause and menopause, understanding the difference between the two and the wide variety of symptoms that can show up, from vasomotor to sleep to mood changes to the vaginal changes, and knowing that this transition can last for quite some time. Around 40 years of age, if we are experiencing any changes in our menstrual cycle or symptoms, we would want to be screened and having conversations around care during perimenopause. The benefits of perimenopause go beyond symptom relief around hot flashes, night sweats, sleep, vaginal health, mood. We see the reduced risk of osteoporosis, cardiovascular disease, and colon cancer risk reduction. So understanding those benefits as well. And we know that no one size for prescription is recommended for all of us. It is very individualized based on your symptoms, your history, and your risk profile. Again, ongoing screening and follow-up is required, and this is the most important piece. So in order to maintain a prescription, to understand your risk profile and if MHT is the right fit for you, screening is so important. And again, outside of menopause hormone therapy, there are so many options for care. So having those ongoing screenings and follow-ups are so important. So if you are hoping to get more information about your health and hormone journey during perimenopause and menopause, we have some booking options at The Root. So you can visit www.theroot.ca, and we have an online booking option. Options are in person, so in-person comprehensive initial, and then also in-person comprehensive health consultation if you are a returning patient. So those are options to consider with regards to care. And that's all the time we have today. If you have any questions, though, or any considerations or want to reach out, please email us at info@theroot.ca. Happy to answer any questions. And we hope that we can provide a little bit more information for your health journey. Thank you so much for your time.